Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. Before I read this week's question, I apologize for my voice. I am trying to get over a cold, and it was really important I get this done, so hopefully you can understand me. For those of you who've seen my or heard my other videos, you know I don't usually sound like this. So this week's question was a little complicated and sometimes hard to understand. So let me just read it as best I can. Had unprotected anal sex and I'm 18 years old. I wanted to ask if the right thing to do about STDs is to get my partner a rapid HIV test to see if I should take any PrEP pills and me make an STD test. It's been 1 day long and tomorrow is the due to my period, though I experienced vaginal discharge and pain when touched the mons pubis and a spotted little red blood a little, and of course for unwanted pregnancy plan B. So there's a lot here. Let me do this piece by piece. If you had unprotected anal sex, then I would definitely suggest getting tested for STIs and HIV. But timing is going to be really important here. You have to wait at least 18 days after you're possibly exposed for a test to be able to tell if you have HIV. Let me explain why. The rapid HIV tests that you mentioned are designed to look for the body's antibodies. These are created after you've become infected with HIV. These tests may be able to detect those antibodies 18 days after exposure, but it can take up to 90 days for these tests to be really accurate. So if you're worried about HIV, get tested a few weeks after the possible exposure, and then I always suggest test again 90 days later, just to be sure. There are other STIs you might want to get checked for also. I'm thinking things like gonorrhea and chlamydia and syphilis. It can take a few weeks for those to show up on tests also. So when you think you're ready to do that HIV test, at least 18 days after exposure, you might want to also do tests for other STIs too. You mentioned PrEP, but that wouldn't work in this situation. So PrEP, P-R-E-P, stands for pre-exposure prophylaxis. It's taken by people who are HIV negative who are engaging in high-risk behavior. This may be something you consider in the future if you're HIV negative and are either having unprotected sex with someone who is HIV positive, or if you have sex with someone and don't use condoms. It can also be helpful for those who inject drugs, but that wasn't really part of the question. Though if you want to know more about PrEP, feel free to reach out to me. People who may have been exposed to HIV can take PEP, P-E-P. This stands for post-exposure prophylaxis. It should be taken within 72 hours of possibly being exposed to HIV. But this is not something you do every time you have unprotected intercourse. This is more for emergency situations. The question mentions vaginal discharge, and I wasn't really sure what that meant. I didn't know if that meant that there was a vaginal discharge or if that there was vaginal sex after anal sex. So if there was a vaginal discharge, that's normal. You have vaginal discharge every day. You just may not notice it. If you had vaginal sex after anal sex, I have some follow-up questions. Did you clean the penis between anal and vaginal sex? Did you use a condom for the vaginal sex? And the reason I ask is that bacteria can easily be transmitted from the anus to the vagina, and that can lead to STIs and other bacterial infections. This can also cause a urinary tract infection, sometimes called a UTI. If it's been a couple of days since you had unprotected vaginal sex or anal sex, then vaginal sex, if you're noticing any kind of new funky discharge from your vagina or there's pain when you urinate, I would definitely suggest talking to a healthcare professional. If you only engaged in anal sex, there's basically no risk of pregnancy. I say basically none because sometimes when there's no condom being used, semen can come into contact with different areas of the genitals. It's not from the sex itself, it's just from how the semen moves around the body. So if some semen got into the vaginal opening, maybe there would be a risk of pregnancy, but it'd be really, really low. Add to the fact that you're supposed to get your period really soon, there's really very little chance of getting pregnant. So this means it's not necessary to take Plan B or use any other form of emergency contraception. If you want to know more about those other forms of emergency contraception, please feel free to submit a question. I would encourage you to think about how to protect yourself from possible HIV and STI infection in the future. Condoms are really helpful for this. But it can also help to have a conversation with your partner before you engage in any kind of sexual activity. Talk to them about your sexual history and theirs, including possible STIs. Also talk about what you're both comfortable doing in terms of risk, also in terms of pleasure. I say this and that you should have the conversation before the sexual activity, because it's really hard to kind of stop when you're in the middle of fooling around and doing stuff and have these conversations. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Twitter. And make sure to check the description for links where you can submit your sex question.